Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today I'm going to talk about something that I've treated a lot of through the years. It's been very gratifying to treat. A lot of people avoid it, but it's ADHD, Attention Deficit Disorder, some people call it. This disorder, if you want to call it that, was identified in 1902 by a British pediatrician in a group of children that were having trouble paying attention. And at that time, it was labeled a defect of moral control. Since that time, we've learned a lot about it. Research eventually found that it can have a genetic basis. It's not a single condition, but a cluster of symptoms that can present differently in people. People are different. Over 11% of our children in the United States have been diagnosed with ADHD from ages 5 to 17. The number of adults diagnosed with it is just 4%. But it's tricky to diagnose in adults, and we're going to talk about that, and thought to be much higher. I can guarantee it's much higher than that. During COVID, the number of people that sought treatment for this skyrocketed. It's all labeled ADHD, but you don't have to have a hyperactive component to it. That's what most people think. You have to be hyperactive to have ADHD. There's really three types. The first is a hyperactive type that you see mostly in boys, young boys, that fidget all the time. There's the inattentive type. You see that more in girls that just don't pay attention. And you have a mixture of the two, a combination of both of them. That's the third type that we see. So as a result, girls are often overlooked when making a diagnosis of this. Adults are often overlooked too. In fact, only 20% of the adults living with ADHD have a diagnosis and treatment that they need. Remember, if you have it, you were born with it. You didn't develop this. When they looked at brains, there are distinct differences in functional MRIs and brain mapping with people that have ADHD, including an understimulated prefrontal cortex. And that's the part of the brain that, as you know, makes executive decisions, organizing, and completing tasks. Note that these brain differences have nothing to do with IQ or potential. Nothing. In fact, sometimes it can be almost a superpower to have this, but you need to recognize it. Risk of untreated ADHD in adults: low self-esteem, anxiety, relationship problems, job instability, substance abuse. You're 3 times more likely to be nicotine dependent if you have ADHD. And you're 50% more likely to have a drug or alcohol problem. And you also have an increased mortality. There's more accidents, there's more suicides. This needs to be recognized because it's very treatable. The other thing about ADHD is it can make you feel very tired. You ever heard of brain fog? Sometimes that's ADHD. People diagnosed with chronic fatigue, which another term for that is myalgic encephalomyelitis. They may have ADHD. It can also cause muscle aches and joint pains. Think fibromyalgia. I've found that treating these kind of patients with stimulants often helps all these conditions. So you need to look into it. There's also an indecision factor that I see in my patients with ADHD, where everyday choices feel paralyzing to that person. This is thought to be from lower dopamine levels in these brains of people with ADHD. Having ADHD can also cause anger and impatience. To diagnose ADHD, you need to take one or more tests and talk to a provider who's very experienced in treating this. It's very rewarding for me to treat this. One of the most rewarding things I really treat, besides hormones, I'd say it's probably second most favorite thing I do. And I like to treat metabolic syndrome, obesity, of course. I use something called a Conners Adult Rating Scale when I'm evaluating patients with ADHD. I don't need to send them to a psychologist for 6-hour testing. I can pretty much, from interacting with the patients and looking at these tests and talking to family members, hopefully, come up with a diagnosis. I also like to rule out sleep disorders. They're very common. When I am in the room with a patient for the first time, they're taking the quiz and we're going over it. I also would prefer to have a other family member there, spouse, to kind of corroborate things. Sometimes other people know you more than yourself, or at least they're more honest about it. Of note is that kids can't be diagnosed before age 4. A lot of times there are coexisting conditions, especially in adults, like anxiety, bipolar illness, depression, autism. Remember, you're never too old to be diagnosed with this. Most people have suffered their whole lives, they never knew it. Women tend to be diagnosed later in life with this than men do. 80% of adults with ADHD have one or more coexisting psychiatric disorders. Another reason it's very hard to diagnose in adults. I often wonder if a diagnosis of a missed ADHD has led to some of the other psychiatric diagnoses. I wonder that a whole lot. Can you cure ADHD? No, but you can certainly treat it very well. Medications are very effective for this, but you also need therapy. My favorite is cognitive behavioral therapy. And you need support and understanding from others, including your physician. One thing I found, look for iron deficiency. Sometimes that's a minor cause of ADHD, just like it can be restless leg syndrome and some other psychiatric disorders. So when I see a patient with what appears to be a psychological or psychiatric disorder, I always get blood work. You need to check the B vitamins out. You need to check their fatty acid balance, their insulin resistance numbers, all that. You need to look at that. Their thyroid, their adrenals. You need to look at all that. So, how do you treat this? There's several ways. OTCs, my favorites are probably L-tyrosine in the morning, sometimes L-tryptophan at night. I like omega-3s, melatonin, ginkgo biloba, ginseng, bacopa, which is another supplement that I use for older people that are getting memory disturbances. Passion flower is another one. There's also non-stimulant prescription medicines like Strattera, guanfacine, and clonidine. I don't use a lot of these because there's a lot of side effects. I just haven't seen them work as well either. By far the most effective treatment is stimulants. And I know some people refuse to take any prescription medicine. That's fine. You can try the others. But in my experience as a physician that blends both traditional and alternative treatments, I can tell you stimulants under the right circumstances can really make a huge difference. They're the mainstay of treatment, really. And you have 3 main ones that you hear about. Ritalin, methylphenidate, which was the first, Adderall, dextroamphetamine, which is the most common that we use, Vyvanse, which is lisdextroamphetamine. It's a longer acting ADHD stimulant, and now it's generic. It didn't used to be generic. These are all Schedule II drugs, meaning they're highly controlled and possibly subject to abuse. In my practice, I don't see a lot of abuse of this. Maybe it's because of the demographics of my patients. But we stick closely to the rules as well. And when you come in, if we treat you with these, you got to stick to the rules. You can't tell us that you lost your prescription. And you can't be filling it at two different pharmacies either. So, and I've had a little bit of that through the years. If you treat enough patients, you're going to see a little of everything. But for the most part, my patients are great. The other thing, too, every time you come in, every doctor and pharmacist knows every controlled substance that you've been on because there's something called a PMP, a prescription monitoring program. It's a database, so we and the pharmacists know everything about your controlled substance use. They're highly regulated. You can't call these medicines in. You're only allowed one script a month at a time. Plus, sometimes we can even do random drug tests to see if you're actually taking the medication and not selling it. Haven't had anybody do that, I don't think. Or if you're on other drugs that you haven't told us about. You need to be very upfront with what you're on. In general, my patients are terrific and cautious. I also encourage them to take breaks if possible. Some people can't, but most can. And I encourage smaller doses. Sometimes we'll even split the doses up. A lot of times people need it to function at their job. And they'll just take it during the week. Research has shown that stimulant treatment does not increase the risk of dependence on drugs or alcohol. This is an important statement. Side effects of these stimulants: they can decrease your appetite, keep a close eye on your weight. We don't use them as weight loss drugs. However, Vyvanse has been approved by the FDA for adult binge eating disorder, which is really the most common adult eating disorder, is binge eating. So sometimes we use Vyvanse for that, but mostly we're using it for ADHD. You may have irritability. Usually don't see that. Sleep disturbances, although most people sleep better on a stimulant that really have ADHD. I've occasionally seen a very mild headache. That's rare. Can these stimulants be addictive? Yes. Like anything, you have to weigh the risk versus the benefits. The pandemic brought about more people seeking ADHD treatment. They were worried. They were at home. They were stuck. They were bored. They couldn't get things done. Their kids may have it, and they notice that their kids have it. Hey, I think I may benefit from this too. I've had a lot of people do that. I've seen kids who I've recognized that their parents have it worse than they do. So, like I said, it's a genetically based disease or disorder. There's still shortages of Adderall. Adderall is the main one that's used nationwide. And there's still shortages really created by the pandemic. And virtual visits skyrocketed too, making it easier to get from providers who don't know you. Many adults have a mild form of ADHD, but were unable to function until faced with the demands of adulthood. I see that all the time. There were very smart people as kids, they got by, but when things really got difficult, multitasking, relationships, jobs, demands, they can't cope as well. And so they need treatment, especially in the workplace. The demands of the workplace are tough for a lot of adults with ADD. They're really tough. It creates a lot of job loss and strife with their work life. What about nutrition? I'm always emphasizing nutrition. Is there an ADHD diet? Not really, but always look at your gut. If you're not taking care of your gut, you're going to have problems all the way through, from autoimmune diseases. We're not just talking about obesity and chronic inflammation, autoimmune diseases. We're talking about psychological. Remember that vagal nerve that connects your brain to your gut? Very important. Everybody needs probiotics. Get enough protein. That seems to be the key with this. If I was to recommend a diet for ADHD, it'd be more protein and good fats. Omega-3s, very important. Remember, those are for your brain. Cut out sugars and food dyes. Horrible for your brain. So treating ADHD is complex. There's no cookbook formula. It requires time and experience, but it can really change lives. It's one of my favorite things to treat. So if you think you may have this, you need to do some reading, talk to your family, take some quizzes, and maybe come in to talk to one of us about it, because it's very life-changing. And so you can see us for this. Thank you. I hope you have a great week, and we'll see you next week.